Assalamualaikum and hi everyone. This video is purpose for our case study MIC 531 that have been conducted by Dr. Rohana. My name is Ahmad Aqmal and my partner name is Muhammad Ashraf and Aqmal. And in this video, we like to share with all of you guys about what is a COVID-19. So, let's get started. First of all, what is coronavirus? Coronavirus disease, COVID-19, is an infectious disease that caused by a newly discovered coronavirus. The official name for this virus named as a severe acute respiratory syndrome coronavirus 2 SARS-CoV-2 named by the World Health Organization WHO. And this COVID virus has been surpassed the SARS that told in the matter of weeks where it is spread faster. This coronavirus is highly contagious disease that causes a respiratory illness that can be characterized in symptoms of fever, cough, muscle ache, and difficulty in breathing. Next is how this coronavirus attack our bodies. The virus can introduce to our body by transmission, adhesion, invasion, and invading to the human cell body. First, the virus was transmitted by the infected person that sneeze or cough, and the droplet that are carrying the virus is released to the airborne, and then it will move to the other person's mouth or nose, and it will enter to their lungs. When the virus enter to the lung, it will attack in three phases, which is viral replication, hyperreactivity of immune system, and pulmonary destruction. The virus then will contact with mucous cell and cellular membrane. Both of these cells help to keep the lung from drying out, and it protect it from the pathogen and help to clear the mucus toward the exterior of the body and clearing the debris from the lung. Cellular cell were the preferred host of this COVID-19 is likely preferred to host for the replication of the new coronavirus. And then, the immune system of human body will interact to the lung tissue, and the lung will become inflamed. The immune system start to be weakened due to the coronavirus infection, and the cells will start to die, can overwhelm the immune cell. And the last stage begin as the damage of the lung increases. It can lead to the potential resulting in the respiratory failure, where the patient in this stage of infection can be potentially get a permanent lung damage, or it can lead to them of death. And now, where and when the outbreak of this coronavirus start? This novel coronavirus outbreak begins in Wuhan, China. On 8 December 2019, the first patient have developed the symptom of Wuhan coronavirus. On 31st December 2019, China has reported to WHO about the several cases of cluster of pneumonia. And then, on 1st January 2020, WHO has set up the Incident Management Support Team to deal with the outbreak of the Wuhan seafood wholesale market. And then the market was shut down due to the several workers that have been infected. On the 7th January 2020, China has officially announced about the identification of the new virus according to the WHO. Several days then, the first death in China was recorded due to this virus. On 13 January 2020, the first cases outside China has been reported in Thailand. On 23 January 2020, the central government of China has announced the lockdown in Wuhan after the breakout of the COVID-19 have been confirmed. Finally, on 29 January 2020, the death toll has climbed more than 132,000 of new cases has been reported. So now, how this virus can spread to the others? There are three possibilities that can be related, which is direct contact, indirect contact and droplet spread. The direct contact can be spread from person to person who are close contact to each other, which is less than 1 meter. The indirect spread can be happen when the infected person was touching an object of the surface with the virus, and then the virus present from the object will be transferred to the other person that have been touching the object, and the virus will be transferred by the person has been touching their mouth, nose, eyes, and others. For example, the object like a doorknob or an elevator button. And for the droplet spread can be happen when the person that have been infected was sneeze, cough, and also talk with that will produce an respiratory droplet, which can be sprayed to the others that have been in close range. This coronavirus have been given a big impact to the whole country world, including in Malaysia. The global crisis that have been faced by the Malaysia is a public health, economic, and also social. First is the public health. The number of the coronavirus positive case have been increases, and also the number of deaths have been also increased by the day. One of the biggest challenge that Ministry of Health Malaysia have been faced, which is that they need to supply a sufficient number of personal protective equipment to the all frontliner and also the healthcare worker. Number of the new cluster of coronavirus also one of the problem that Malaysia Ministry of Health have been faced. In order to reduce and track the cluster of this coronavirus, Malaysia have been introduced the apps named My Sejahtera. This app help the government to track every people that have been in contact with the coronavirus person. Ministry of Health also have drafting a guideline in order to reduce the number of cases and detecting the number of new cluster of COVID-19, and they also have been educate the people about the social distancing education. And next is the global crisis in economic. According to the Bernama News, there are millions of workers have through the world that might lose their job by the world economic crisis. In Malaysia, there are many industry sectors that need to be closed or shut down due to this coronavirus crisis. Luckily, in Malaysia, the Malaysia government have been introduced the stimulus package, which is named as a Prihatin. The main objective of Prihatin is to protect the welfare of people, support business, and strengthening the economy of Malaysia. Over 250 billion ringgit have been provided for the Prihatin package.
The next crisis from the pandemic of COVID-19 has affected the social in Malaysia. The Movement Control Order (MCO) has been done with very strict law and various prohibition across the country. All the government and private sector has closed except the essential sector. All the school and university was closed across the country. The police and the Royal Malaysian Police (PDRM) has involved in the MCO. The penal code was made including a punishment to those who unfollow the order and can be fined up to 1,000 ringgit and can be jailed. In Malaysia, there are some drugs has been used in treating patients with positive COVID-19 infections. The drug was administered under the guideline of Kementerian Kesihatan Malaysia (KKM). There are 3 types of drugs used in early stage of the infections: hydroxychloroquine with 400 and 200 milligram strength per tablet. Next, leponavir or ritonavir drug, and ribavirin and interferon beta drug was used. The new antiviral drug remdesivir was introduced in Malaysia according to Health Ministry of Malaysia, Datuk Dr. Nur Hisham Abdullah. Prevention measure has been done in Malaysia. The Movement Control Order MCO has been done by the Government of Malaysia. Future prevention. The WHO has given the guideline to protect yourself from COVID-19. First, regularly wash your hand with soap. You can also use alcohol-based hand wash or hand sanitizer. And make sure to learn the 7 steps of hand washing. Next, maintain 1 meter distance from others, especially around the crowd. Do not touch your eye, nose or mouth with your hand before your hands are washed. Wear face mask when going outside your home, especially around the crowd. Stay home if you feel unwell to prevent others from getting sick. If you feel unwell, seek for medical attention. Finally, follow the direction of your local health authority. Thank you for listening, and make sure to click the like button and share with your friends. Thank you.